Let's talk about the two most commonly asked questions by our patients who undergo breast reduction. The first most commonly asked question is, Doctor, how are my scars going to be after a breast reduction surgery? Now, you must understand that in breast reduction, it's not only the gland which is removed, it's also the skin. So obviously you're going to have a scarring. But because of the advance in surgical technologies, we choose to give our patients the minimal scarring. Now there are two techniques which I will talk to you about, breast reduction techniques which are most popular, most commonly done, and I'll tell you what we do. Now, a majority of surgeons across the world, they give what is called as a anchor incision, which is a vertical incision like this, and it's got a horizontal incision this way. Now you can see this is like an anchor shaped, that's why it's called an anchor incision. And this is, to us, it's very extensive. Especially this part of the incision can actually enlarge in size and cause scar hypertrophy, and we don't like this type of scar in our Indian patients. So what we do is, this is extensive, we do something which is, if you see on the left side, you can see the incision runs from the lower part of the areola and it takes a gradual curve meeting the inframammary crease over here. So you have a lazy C kind of a incision. So this is what we give. We completely avoid this kind of incision, and this is a very minimalistic incision. And even after a few months, you'll find that once the breasts are nicely falling, it's only this part of the incision which is actually visible. So there's barely any scarring seen in our breast reduction surgery. Okay, this is about the scarring. The second most commonly asked question is, Doctor, will I be able to breastfeed? Yes. Now the answer to this is yes and also no, because there is a small percentage of patients where you can actually have scarring and the breast glands or ducts can get blocked. So we don't really guarantee our patients, but however, our techniques will make us preserve the breast glands for almost 4 centimeters below the nipple-areolar. So because we are maintaining a chunk of tissue below the nipple-areolar for almost 4 centimeters, there is a significant chance that these patients breastfeed. And often I get calls from my old patients who've actually conceived and who are breastfeeding. They say successfully that they have breastfed and there's no problem with breastfeeding. So yes, the answer to this is they can actually breastfeed because of the surgical techniques, and this is also possible. The other commonly asked questions are, women ask us whether they can actually have a breast reduction after completing their family, or can it be done before. Now my advice to them would be to actually complete their family and get the breast reduction done. For the simple reason is they have to breastfeed their children, and once they complete their families, and whatever is the structure, whatever is the enlargement in the breast, that can be actually removed in a final surgery after completing their family.